Have you ever felt like a cloud was hanging over you, but no one else could see it? Like the world kept moving, but you were stuck in place? That's what depression feels like. And it's more common and more serious than most people realize. Hey everyone! Welcome back to the EduTech channel, your go-to place for future-proof learning. Depression, or major depressive disorder, is a real medical condition. It's not just about having a bad day or being moody. It's when sadness, emptiness, or lack of interest in life sticks around for weeks or even months, and it starts to affect your everyday life. Doctors use a guide called the DSM-5 to diagnose depression. According to it, a person must have at least 5 out of 9 specific symptoms for more than 2 weeks. These symptoms include feeling sad or low most of the day, losing interest in things you used to enjoy, changes in weight or appetite, trouble sleeping or sleeping too much, feeling tired all the time, moving or speaking more slowly, or being unusually restless, feeling worthless or guilty, trouble thinking or making decisions, thoughts about death or suicide. To be considered depression, these symptoms must make daily life harder, and they can't be caused by another illness or medication. Why do people get depressed? There's no one simple reason why depression happens. It's often a mix of things. Genetics play a big role. If someone in your family has had depression, you might be more likely to experience it too. But life events matter a lot as well. Things like losing a loved one, going through a breakup, losing your job, or facing trauma can trigger depression, especially if you're already at risk. Think of it like this. Everyone has a stress cup. Some people's cups are already half full because of genetics or past experiences. When stress pours in, their cup overflows faster. What happens in the brain? Depression isn't just in your head, it actually changes how your brain works. One theory is that depression is linked to low levels of certain brain chemicals like serotonin and dopamine. These help regulate mood, energy, and motivation. But the brain is complex. It's not just about chemicals. Some people with depression have too much of the stress hormone cortisol. Others show signs of inflammation. That's when your body's immune system is overactive, which might also affect your mood. We still don't know everything, but science is helping us get closer. Who gets depression? Depression can affect anyone. Kids, adults, rich, poor, famous, not so famous. Around 1 in 8 people will experience it at some point in life. It's more common in women than in men, possibly because of hormone changes, life stress, or how emotions are expressed. And it's not always alone. Depression often comes along with other problems like anxiety, ADHD, or addiction. These can make things even harder. How is depression diagnosed? To find out if someone has depression, doctors usually do a full checkup. They'll ask questions about your thoughts, feelings, and behavior. They might use a survey called the PHQ-9. It's a quick tool that helps measure how serious the symptoms are. Doctors also make sure the symptoms aren't caused by other problems, like thyroid issues, certain medications, or another mental illness. Getting a proper diagnosis is the first step to feeling better. How is depression treated? The good news? Depression is treatable. Most people feel better with the right help. Therapy is a powerful tool. One type called cognitive behavioral therapy, or CBT, helps people change negative thought patterns and learn better ways to cope. Medication can also help, especially for moderate to severe depression. These are called antidepressants. They work by balancing brain chemicals over time. There are different types: SSRIs like sertraline or fluoxetine, SNRIs like venlafaxine or duloxetine. Each person responds differently, so doctors sometimes try more than one. Lifestyle changes matter too. Getting exercise, sleeping well, eating healthy food, and avoiding alcohol and drugs can all support recovery. And for people with severe, hard-to-treat depression, there are advanced options like electroconvulsive therapy, or ECT. It's not as scary as it sounds, and it can be life-changing for some. If you're dealing with depression, remember this: you're not alone. Millions of people go through it, and with support, things can get better. Depression doesn't define you, and it doesn't last forever. Talk to someone. Reach out. Healing starts with asking for help. Thanks for watching Understanding Mental Illness. In our next episode, we'll talk about anxiety disorders, what they are, and how they affect the brain and body. If this video helped you, give it a like, share it with someone who needs it, and hit subscribe to join us for more. Take care of yourself.